Welcome everybody, and thanks for joining us this Friday afternoon. We are delighted to share this webinar with you to tell you a little bit about some of the findings we found from the Transform project and some future directions as well. I just want to start by acknowledging the traditional custodians of the unceded lands on which this research we're about to share has taken place, and from where we're all joining in today, we pay our respects to the elders both past and present, and to all Aboriginal and Torres Strait Islander peoples with us today. We also acknowledge that trans people are ancient. These lands are the home of the oldest continuing culture and therefore the home of the first scientists, the first researchers, and the home of the oldest examples of gender diversity. So we also want to thank all of the wonderful collaborators who've contributed to the various projects, our amazing 2,000 trans and gender diverse research participants, as well as our funding bodies and endorsing organisations. Just a content warning that we're going to talk about some pretty challenging topics, including depression, self-harm, suicidality, discrimination and violence. And if this causes you any distress at any point, please feel free to step out. And we've also got some some crisis support lines here that you may wish to seek some support from. So this is what we're going to talk about today. I'm going to start with an introduction, tell you a little bit about what we do, and then Sav Zwigel is going to tell you more about the Transform Research Project, some of our recent mental health findings and the impact that this has had, and some of our future priorities. So firstly, why do we research trans health? And I really fell into this space after myself and a colleague started working at a clinic after our hospital had declined to see trans people. And when we started working in a clinic servicing only trans and gender diverse people in about 2015-16, we really saw this exponential rise in demand for gender affirming care. And this was being mirrored not just in our clinic in Heidelberg in Melbourne, but also around the world. And we don't think this is because there's all of a sudden more trans people, but what we hypothesize is that this is related to more visibility of trans people in the media, social media. People have access to information. There's language development. So, in 1950, people wouldn't have heard about the word trans or gender diverse, and definitely not the word non-binary. But now there's language, there's less stigma, although we still have a long way to go. And people know that there's actually services and help available. I also saw in the clinic these enormous barriers to health that my patients were facing. We not only saw this in our clinic, but when we surveyed the first cohort of about 1,000 trans Australians, we saw really alarming rates of depression affecting nearly 70%, suicidality. We saw widespread discrimination in almost all aspects of life. So trans people, in addition to dysphoria, we're facing challenges with employment discrimination, street harassment, housing discrimination, physical, verbal, and sexual assault. There's, transphobia and this political footballing that's occurring. There were barriers to people finding basic medical care, like people couldn't get GPs, and enormous barriers to accessing gender affirming care. And even if people could access care, we saw this real lack of research to guide care. And really, we were making things up. We really didn't know what was the best way to give hormone therapy, or how do we improve mental health? How do we best deliver health services? And so because of these three reasons, this huge clinical need, these enormous barriers to health, and a low level of evidence, I thought, well, we've got some of the skills to answer some of these unanswered questions. And so that's when the Trans Health Research Group was born, about 2017. And we now work with community to ensure that every project is co-designed. In fact, half our team are trans people themselves, researchers, PhDs, health professionals with lived experience. And we focus on three community-driven priorities. So the first being mental health and wellbeing. We've got all sorts of projects, including Transform, which we'll tell you a bit about today. Research to improve health service delivery. How do we best get services out in the community, and what are the best models of care? And thirdly, we do sort of research in gender-affirming hormone therapy, so understanding the effects of hormones on various body systems, immune function, fitness and strength, heart function, and also clinical trials. And we make sure that every single one of our projects is the findings are communicated back to community, and every one of our projects has to contribute to improving the health and well-being of the trans community on the ground. And so today we're going to zero in on one of our projects, Transform, and I'm going to hand over to Dr. Sav Zwickel to tell you more about this.
Great. Thank you so much, Ada. So yes, the focus of this presentation today is on the Transform project, which has actually been running for 4 years now. We're about to hit our 4-year anniversary next week. So I want to take you through a little bit about the design of Transform, because it is quite a unique research design, and explain why we've made these decisions as well. So rather than a one-off survey, when we were coming up with what we wanted Transform to look like, we thought, people often give, 20 minutes of their time to complete a survey. They share often really personal information, and often you just don't hear what comes of that research. And so we wanted a way to keep the community involved and to share the progress of the research with them. And so we set up this longitudinal project. So essentially, it's open to anyone over the age of 16 who's trans or gender diverse and currently living in Australia, and we have ongoing recruitment. So people who are interested in being part of Transform, they complete an enrolment survey, which includes basic demographic information as well as their email address. And we use their email address for 2 main purposes. The first is to send them invites to complete sub-surveys as part of Transform. We typically run between 1 and 3 surveys each year, and to provide them with research updates. So if there've been publications, media engagement, big news in terms of being included in policy or something like that, then we update the participants via email updates as well. Another unique part of Transform is entirely trans-led. So trans people lead every stage of the research project, from those beginning design stages of a survey right through to analysis and outputs of the research. So we work together collaboratively with community organisations and a community advisory group, which includes community representatives that are quite diverse in terms of their experiences, including trans people with disability, trans people from migrant and asylum seeker backgrounds, as well as Aboriginal and Torres Strait Islander trans people. As well, when needed, seeking input from specialist clinicians. And together what we do is identify community priorities and design studies around that. We don't want to do research just for the sake of something being interesting. We want it to be meaningful and relevant to the trans community. We then take all our research to 3 different ethics groups: Austin Health, Thorn Harbour Health and ACON. And the reason we do all 3 is it just means extra sets of eyes over the research, and often we'll get really useful feedback on how to make the research more inclusive and accessible. Every one of our studies that we do as well, we also ask for participant feedback, and that's always optional, but we actually get quite a bit of feedback. And so that can be positive stuff like, oh, I really found this really inclusive of my particular experience, or it could be, hey, I didn't really understand this question. This didn't fit my experience. And from that, we can shape future surveys so that Transform is always improving in terms of accessibility and inclusion. So in the last 4 years, we've run 7 sub-studies as part of Transform. 2 of those, which I'll talk about a little bit more in depth, are related to mental health and impacts of the pandemic. We've also looked at testosterone, persistent periods and pelvic pain, really common issues but poorly understood within the community. We've looked at estradiol levels and what might be optimal estradiol levels in terms of balancing risk versus wellbeing. We've looked at sport participation and mental health. And we've done interviews with people experiencing suicidality to discuss, what their support avenues have been and what those experiences have been like. We've also worked with researchers at Swinburne University in the development of a scale to measure gender euphoria, and that will actually be the very first scale in the world to measure that. So what we're going to focus on today are key mental health findings from Transform. and in particular, these two surveys that we've done around the pandemic impacts. So when the pandemic first hit in March 2020, we realised that the trans community in Australia were not only experiencing pre-existing and ongoing discrimination, violence and health inequities, all those things that Ada kind of touched on earlier, as well as this sudden onset of pandemic-related stresses, lockdowns, job loss of social connections, everything that kind of happened in those first few months that really disrupted our lives. And so we set about developing a survey that was released in May 2020, and we followed that up again with the same group of participants in May 2022 so that we could look at differences over time. So I'm not going to go into depth on the 2020 findings because they have been published in a few different avenues now, and they are widely available by peer-reviewed publication, or on the left there's the Trans in the Pandemic report, which is available from our website. But what I will focus on is the 2022 data, because this actually hasn't been published yet. And so this was conducted in May 2022, coming close to 2 years ago now. So we had just over 500 trans people complete both the 2020 and 22 surveys. And the median age was 33 years. And as you can see from that graph on the left there, skewed towards a younger age group under 45, but that's pretty typical of trans-focused research. And in terms of gender identity, speaking broadly, categorising people as trans women, trans men or non-binary, there was a pretty even split between the three. So there are a few measures of mental health that we've used. The first is the PHQ-9. It's a 9-item questionnaire that anyone who scores over 10 in that questionnaire, it's a signal of clinically significant symptoms of depression in the previous 2 weeks. We also used item 9 of the PHQ-9, which states, have you been bothered by thoughts that you will be better off dead or of hurting yourself in the last 2 weeks, which the EUs refer to as thoughts of self-harm or suicide. In our 2022 survey, we also asked, have you self-harmed since the start of the pandemic in March 2020? And have you attempted suicide since the start of the pandemic? So part of the reason we chose the PHQ-9 is because it'd been used in previous samples of the trans Australian community prior to the pandemic, as well as there was a general population Australian survey conducted in those first few months of the pandemic using that measure too, which allowed for those comparisons to pre-pandemic trans community and the general Australian community. So what you can see here is the percentage of participants in each of those surveys that met that criteria of clinically significant depression. And what we can clearly see is with the onset of the pandemic in 2020, an increase in depression, and that was slightly lower by 2022, but still sitting relatively high compared to pre-pandemic levels. When we look at that by age, we see that those in the younger age groups at 18 to 25 were most likely to have depressive symptoms, followed closely by those aged 26 to 45. And when we looked by gender, those who are non-binary had highest rates of depression. So we're able to do the similar thing with thoughts of self-harm or suicide and kind of map it at various time points. And you can see that it's sat really, really high for quite some time now. So over 40% expressing thoughts of self-harm or suicide in the preceding 2 weeks of each of those surveys, the 2013 HIDE survey, our 2020 survey and our 2022 survey. Obviously really, really concerning, and it just seems to kind of be sitting there fairly consistently. In terms of age, again, we see that those in the younger age group are most likely to report those thoughts or feelings. And in terms of gender, non-binary people, again, most likely. Over 1 in 4 of the survey respondents, 27%, had self-harmed in the first 2 years of the pandemic. And that was most prevalent in those aged 18 to 25 at 43%, and in those non-binary at 36%. Just under 1 in 10, or 8% of the survey respondents, reported a suicide attempt in the first 2 years of the pandemic. These are obviously really, really startling kind of statistics, but it's pretty consistent with what other studies have found at various points, that within any kind of 12-month period, it sits around 1 in 10 trans people have attempted suicide in that year. The rate was 13% in those aged 18 to 25. And as you can see on the right-hand side, in terms of gender, much higher rates of suicide attempt in trans women at 11%. What we don't capture here, obviously, is deaths by suicide. And, that is obviously a huge, huge concern, and something that's been highlighted by the Victorian Coronial Inquest recently, which focused on the suicide deaths of 5 trans women during this pandemic period. So we wanted to also look at what experiences might be associated with these higher odds of negative mental health outcomes. And something that's consistently been seen across, other research that we've done, but also more broadly in the general community, is around unemployment and financial strain. So in this study, we found unemployment was associated with higher odds of depression, thoughts of self-harm or suicide, and self-harm. Financial strain was associated with higher odds of depression, thoughts of self-harm or suicide, and suicide attempt. Participants who reported severe symptoms of COVID illness or hospitalisation from COVID had higher odds of suicide attempt. And we also looked at discrimination experiences in healthcare. So that included things ranging from being misgendered, dead named by healthcare professionals, through to complete denial of care for being trans. And those kinds of experiences were associated with higher odds of depression, thoughts of self-harm or suicide, and self-harm. So although we have a focus on peer-reviewed publications, so getting into peer-reviewed journals, a really big part of what we do is making sure the research reaches the people who can create change. And so we spend a lot of our time engaging with stakeholders and in advocacy. So that ranges from federal to state to local government to community organisations, mainstream organisations, and educating healthcare professionals. And what we do there is we highlight community priorities, things that come up through the data, as well as make recommendations. And a lot of those recommendations are around increasing funding and resources for trans or community-controlled organisations, as well as training for healthcare professionals around trans health. We also advocate for changes in policy and practice, with the outcome that we want always being improved access to healthcare and improved health and wellbeing for the trans community. Here are just some examples of real-world impact our research has had, particularly in Victoria and New South Wales. Our research findings have contributed to the Victorian government providing funding for 2 new gender clinics and a statewide training program for GPs, as well as a statewide peer support program. More recently in Victoria, also funding towards mental health support services. And New South Wales, our research is cited numerous times in the New South Wales LGBTQ+ health strategy, as well as has supported requests for funding that the New South Wales government has delivered to improving mental health services for trans people. Aside from the stakeholder engagement, we really prioritise community engagement as well. So that includes engaging with the media, so doing interviews for mainstream media, social media. We're pretty active on our social media accounts on Facebook and Instagram. Community reports like the Trans in the Pandemic report I showed you earlier. Community blogs. So we write blogs where we translate peer-reviewed publications into much more accessible language. They're all available on our website, and some of them have had over 10,000 views. So we know that the community are engaging with them. And we do webinars and seminars like this one. The goal is to, firstly, to share the research with people who have engaged with it themselves, who've given their time and energy. We want to, prove to them that we're doing as much as we can in terms of bringing about change for our community. And it's really important there to be elevating the trans lived experience. So much of the conversation had around trans people and trans health is about us, but not with us. And so it's really important to bring in trans experiences into those discussions. And, with so much disinformation floating around at the moment, making sure that the community has access to accurate information. We also want to show trans people that they're not alone in their experience. It can be really isolating to be a trans person. So to have that representation, to know you're not alone in your experience, can be really, really valuable. Here are just some examples of some of the media coverage that's come from Transform Project. You can see on the left, second down there, the title says Transgender Mental Health in Crisis, but Support Groups Desperately Unfunded. So that's an example of where we're trying to advocate and really highlight, there's such a need for mental health support, but a real lack of funding. And here are just some examples of reports and blogs and some of our social media tiles that you can see on the right there, where we've taken quotes from Transform participants, presented them on social media tiles just to make them more accessible to people. So the question then is, what's next for Transform? We've been at this for 4 years. What comes next? Well, as we've covered in this seminar, our previous mental health surveys in May 2020 and May 2022 really focused on the COVID-19 impacts. And that's felt really, really logical and important at the time. And when we were discussing what to do next, we really wanted to maybe shift course a little bit. And we felt like we've collected enough data around COVID, and maybe it's time to look at what the other priority issues might be for our community and what impact they are having on mental health. And so through a lot of discussion with community, there were a few topics that we just could not go past. One of those was housing. So looking at trans people's experiences of housing, the barriers that they've faced, the positive experiences they've had too, what has it been like to deal with real estate as a trans person, for example? That kind of research hasn't really been collected here in Australia. So it will provide us some really valuable insights. Employment too, really kind of exploring in more depth what the experience is like for trans people in employment, positive experiences as well as negative experiences and experiences of discrimination. We want to look more in depth too at healthcare experiences, be that positive or negative, and in particular, barriers to mental health care that people are facing. And we couldn't go past to anti-trans news and social media, as well as anti-trans events. And so, we'll be looking at what kind of things people are exposed to, the degree to which they're exposed, and the impact of that on mental health. So all things going to plan, the third biannual mental health survey will be launched next week. And at 4 years running, we've got about 2,000 trans and gender diverse people already involved in Transform. So those who are already part of the project will automatically receive an email invite to complete this new survey. People who aren't involved, so again, anyone over 16, trans or gender diverse and living in Australia who's keen to be part of this, they can enrol using that QR code or through our website or the link that's on the screen now. And once they complete their basic demographic information and give us their email address, they will automatically receive an email invite to do that survey. And at any point, people can disengage from Transform. They can leave the survey without any, there's no ramifications, no worries at all. If you just want to do that one-off survey and that's it, absolutely fine. So I've just popped our contact details on the screen as well. Any queries related to the Transform project can be sent to transform-research@unimel.edu.au. Our website, transresearch.org.au, you can find research blogs, all our peer-reviewed publications, all our ongoing research, so not only Transform, but other projects that we're recruiting for at the moment. And as I said, quite active on Facebook and Instagram as well. Feel free to follow up with us via email or through our social media accounts. We're always happy to chat, to take feedback, whatever it is. Thank you very much, everyone.